join me in welcoming Mark from Manulife and Varun from Singlife together with Wei Chen. Over to you, Wei Chen.
Thanks, Cassandra. I'm just going to ask a really cheeky question. Who here thinks that there isn't enough mental health insurance coverage? Great, we're at the right panel. Right, you can take a seat, gentlemen. I have with me two amazing gentlemen here today. First on my left, I have Mark. Mark is the CMO of Manulife. He leads the marketing, communications, customer experience, and advanced analytics capabilities for Manulife Singapore. He has more than 15 years of experience across multiple leadership roles in the region, spanning consulting, startup, and financial services as well. Welcome, Mark. Next, I have Varun, Head of Innovations and Ecosystems in Singlife. Varun leads the innovation ecosystem at Home Group financial services company Singlife. He collaborates closely with both internal and external stakeholders to adopt transformative ideas, as well as develop partnerships with key industry speakers. Sorry, my voice is a little bit break. I've eaten too much mooncakes. Happy Mid-Autumn Festivals, everyone. He has been involved in various technology service companies throughout his career. He's also the co-founder of Singapore FinTech Association and ASEAN FinTech Network as well. Please give a round of applause for our panel, please. Now, for the first questions I have today, really wanted to take a lens of if you were to put on the investor hat today and look at the mental health festival and the mental health insurance industry in Singapore as a startup itself, how would you assess the potential?
Mental health industry is a lot more winner takes all kind of industry because you cannot have a new therapist talking to you every time you talk. So there is a significant amount of inertia, but also there is a significant amount of trust level you need to have before you open up to specific platform. So from an investor hat, I would say it's a lot more similar to e-commerce from that perspective, because you look at any global market, you have no more than 2 or 3 e-commerce winners in a specific market. The second part, which is very niche for mental health, is to look at will there be a specialist play or a generalist play. So similar, I would say, is a music and video industry. You will have a Netflix and a Spotify, which are one verticals, but the bigger platforms will have their own vertical, which will be giving head-to-head competition. So you'll have a YouTube and Instagram, for that matter, competing with a Netflix. You'll have Apple Music and similar plays competing with a Spotify. So the market will consolidate at the end, where I would say half of the winners would be probably telemedicine players or traditional healthcare players who add this, and the other half would be vertically specific niche players for mental health. So from that perspective, it's a play where you have to focus on which players have an ability to consolidate and take as much ground as possible from that perspective. And that creates like sizable outcomes from an investor perspective, but it's very important to pick the right partners.
Mark, is this something that you agree with?
Yeah, completely. I think it was some very important points. And I think the other piece is really, in terms of potential, I think events like today and also some of the studies are showing that the awareness for mental health and mental well-being is increasing quite dramatically. So I think the space is evolving quite quickly and there's a lot of opportunity to grow.
Super. So we all agree that there's significant demand for it, right? What we understand is that a number of insurers have launched personal and corporate mental health insurance and policies in Singapore. What are some things that you think is missing, and hence, what more innovative approach can insurers in Singapore adopt to expand mental health coverage?
Yeah, I think if I take a step back and I think of it from a marketing perspective, I look at it from 3 different views. One is the need clear. So with mental health, mental wellness, and insurance related to that, I think it's so broad that it's still, in many cases, unclear what are the different categories of needs that exist to support mental wellness. And I think depending on an individual, the needs will vary at different points in time in your life stage. The second part is really about the priority of that to you as well. So again, as you progress through different stages in life and you have different experiences and situations occur, the priority of mental health insurance or mental wellness will change over time. And then finally is the affordability. So the affordability of being able to afford the premiums to pay for mental health insurance, or to subscribe to an app, or to subscribe to start seeing a counselor and things like that. All three of these factors are unique for every single one of you. So I think one of the important things is really, how do we start to address different capabilities for each of those three pillars? So I think we're still in a stage where the need piece really needs a lot more clarity and a lot more research and data and things like that to start to come through, so we know how to actually identify the need, how to educate people on the need, and then we can start building through on the priority and also the affordability pieces as well. I think one last point to raise, I think one parallel we can also look at is critical illness. So critical illness is something I think everyone really knows well right now. But if we rewind maybe 20 years, don't really know too much about it. If we look at critical illness now, we have late stage critical illness, we have early stage critical illness. And early stage critical illness is still quite emerging, actually. And why that's been the case is because it just has been such an unknown and evolving space. So studies, data, some of the information that Intellect is collecting becomes extremely important to helping frame and structure that need category in the market for that as well.
And just to dive a little bit deeper, right? On a scale of 1 to 10, 1 being that, hey, we're not ready here today, and 10, we're super ready, right? Where do you think we are, and how can we move to the next step here?
I think we are maybe 2. And maybe I'll give some examples. I think where the need is known very well. So for example, for maternity insurance, we've actually been able to launch a product called Ready Mama, which does have some mental health support and insurance claimable benefits that are included as part of the products. I think we do need to do a lot more clinical studies, a lot more partnerships with different providers like Intellect to start capturing more and more data about different types of situations, diagnosis, and things like that to see what needs to be done. But I think there's a lot that can be done in the interim. So don't wait for insurance to come up with a package for you to start receiving a benefit because you've been diagnosed with something. I think we can be a lot more preventative. And I think that's very important. And specifically with insurance, we're selling promises. We're selling you a promise that we're going to pay you if something goes wrong. So that's also part of being mentally well prepared, that you know that you'll be covered for something if something does eventuate. But our job is also, how do we keep that front in mind for you, that you're educated, you know what you're eligible for, how to pull down on those services and things like that. And that can also tie into some of the support that we provide as well.
Absolutely, thanks. Varun, what's your take on that?
Building on to what Mark said, this specific products, which have already enabled some of it from our perspective, even if we were to look at our EB or a Shield product, but the key part is there are 3 levels to it. You have coaches, you have therapists, and then you have actual physical clinic specialists, where if a person has trauma and they've gone through something, and the doctor in the actual hospital will take you to somebody there, or somebody will go through an accident and somebody will talk to you. So there are different layers. So I would say anything which happens as part of when you are already in a hospital, or when you're already in a traditional doctor's clinic setup, those things are much more clearer, because along with mental health, along with a few things which have emerged, I would say more in the last 5 to 10 years, there is a huge difference on what is need and what is elective. There are people who would say a chiropractic is my need, and they would some say it's elective. Similar would be, I would say, physiotherapy. They would say it's, in Singapore's context, if you were to say, people would acknowledge TCM is a need. Try to do that in the United States. You would not have TCM as a need. That would be an elective. So it has to be also a lot more culture sensitive. You go to India, for example, Ayurvedic would be considered as a need, but in Singapore it would be elective. So which is why a lot of stuff, because if people say, I am stressed and I need to talk to someone, try to go CBD, you will find 25% people will say, I am stressed. I'll do a reverse survey. How many people think, how many people here think they are not stressed and do not have pressure at their workplace? Which also will create a second order effect. Singapore is a very expensive country, sir. So if you do not have work, then either you are born into rich or you will have a mental health problem very soon. So which is where it's very important to say what is the actual classification of what is need. Because when people say, you mentioned the surveys, right? 84% people say, I understand. But if you were to say that all of this is qualified as a need, but then the cost and the calculation to what Mark mentioned, the data and stuff would need to factor all of that in, then you will have a significant affordability. If 84% people have an illness, technically, let's assume it is, and it's not covered, and all of that gets featured to the whole population, then one side, the government is trying to balance medical inflation. The other side, you have this. So this needs to be a balance from that perspective. And I would say the biggest component is what is need and what qualifies as need. And that would change by country, by jurisdiction. Developed economies will have a different definition of what is need versus emerging economies. So from that perspective, the regulators will come in at some point. So they have defined some of those things in some markets for different alternate medicine therapies. I would say this is closest to alternate medicine therapy from that perspective. There would be classification. Until that time, there would be private healthcare. So the private models will work. And we are also trying to develop some of those private models for those niche corporate or individual customers. And at some point, there will be enough data to qualify what is need. And then it starts to flow into the base plans.
Yeah, thanks, Varun. I think just want to dive a little bit deeper on that point over there, right? You mentioned that there is a wide spectrum of needs. What we are seeing today is that a lot of insurers are focusing on psychiatry needs. There is a diagnosis, and then there is a treatment plan that is covered after that as well. Do you think the insurer should take one more step further and say that, hey, should we cover for counseling needs? Or do you think that that's a step too far? I want to hear both your opinions on this as well.
The premise is there is a cost to this, right? And counseling does not have an end date. It's a continuous thing. It's not like you have... counseling is not antibiotic that you have a 5 medicine course. So from that perspective, insurers are in a business of risk pooling and risk pricing. That's fine. If there is enough need, and there are private plans for that. The question are enough customers willing to pay that price from that perspective? So if there is a need for it, of course, we are in that business. If there is a need for it, sure. Right now, if you were to look at from that perspective, how many customers are willing to have their premium go up 20% for this? If there is enough market, there will be a product.
Mark?
Yeah, I think from the Swiss Re study, we see that actually many customers actually don't want to pay more than 10% increase in their premiums for mental wellness support services. But I completely agree with Varun that if there is a need, there is also an opportunity. But I think before that crystallizes, we need to explore and test certain things. So I know in certain cases at Manulife, we're also offering Intellect to customers directly as part of just being a customer of ours. And I think one of the key challenges is actually making sure that they do adopt the solutions. Whatever the solution is that we provide, it's important for consumers to start to consume the services that are being provided to them. Otherwise, again, to that point around capturing data, understanding what's working, pooling of risk and things like that doesn't really become true. Becomes something which is a nice to have. But really, when you're in the business of trying to build a solution which can be scalable and provide benefits and services to everybody, you really need to make sure that what's being provided is adopted and it's going to be used and then is actually effective in helping consumers live healthier and better lives.
Now, just going to move the needle a little bit forward, right, looking ahead. I know we've seen in the physical space that many insurers have invested in physical health trackers. Whether it's the Man on My Move app, the AIA Step Challenge, and getting people to get a little bit more active, and therefore theoretically healthier pool of customers and better loss ratios as well, right? Do you see mental health going in the same direction? And if so, what are the potential blockers or implications to the insurers?
Yeah, I think I see it going in a very similar direction. I think in some of the studies that we've done through our Asia Care survey, we do see a very strong correlation between exercise and mental wellness. So I'm not sure how many of you are crazy like me and wake up at 4:30 to go cycling or running in the morning, but actually I feel really good by doing it. It really gets a lot of stress away. And our Move platform, we've actually extended it to staff and started to gamify walking and doing different types of challenges and activities, because we do see that not just the action of walking and being more, I guess, active, but doing it with people and achieving certain goals actually helps stimulate people's creativity and also their mental wellness. I think for the mental wellness apps and the ecosystems which are sort of evolving at this point in time, I think they'll go in the same direction. But I do see there's a huge amount of curiosity. I think there was about 40 something or more % of consumers were saying they do want to explore self-help for mental wellness. And I think that's also part because people are still quite shy about talking about it. So they want to look at it themselves. They want to be able to interact with something which will give them some feedback, give them some dopamine. But people are still probably resistant to reaching out and speaking and saying, hey, I need to speak to a counselor. So I think, the platforms are going to evolve over time. And I think making sure, especially if I'm a corporation and providing this to my employees, how many of my employees are actually using what we've provided them with? Are the ones who are using it actually finding it valuable and getting better outputs or outcomes from it? I think is important as well. So I think it'll evolve in the same way. But I think there's some certain key steps that we need to make sure happen that it does come to fruition.
Absolutely, Varun. Do you see it going the same direction, or do you have
I don't think it would go into the same direction, because there is a massive difference, as I mentioned initially. Anything mental wellness has a strong inertia, because you need a history of the communication, history of that person. When you have a health tracker, today I have an Apple Watch which is connected to this, tomorrow I have a Garmin, third day I have Android. It's all fine, it works. So you don't need any connectivity. There is no need of background. You can switch devices very, very fast. And you don't need to personalize it. You don't need to spend time, like you will have an aggregator who will connect it to different wearable devices, similar standards, works. The moment you get into that, the person would need to make a conscious effort, but then the person has to tell, who am I, what am I feeling, what happened, and that is not portable that fast. So, which is why my view is that, and there are those checks that, okay, here is this, answer these 5 questions, and that will tell you, are you good or not good? If that is the definition, then sure, that works. But there is anything more than self-help is not easily portable. It is not transactional in nature. There is a lot of emotional connectivity you would want, and you do not want to repeat yourself again. And it is very tough for, I would say, platforms to provide the same human again. And I don't think generative AI is anywhere close to playing in this domain. I mean, basic stuff is okay, but not this domain. So which is why, how do you provide consistency in this? That's the biggest challenge. If this person wants to talk once a week, that person also does not know what time of the day he or she wants. And if you are that, I mean, how many customers would be that, okay, I want to schedule every Friday 3 to 5 p.m. or 3 to 4 p.m. And that is the time I want to talk about this thing. Sure, my personal view is that would be a very small segment. So it's not that portable. I would say it would be a lot more closer to the coaching part of it will probably, because coaching, you don't need as much connectivity. The moment it goes anything deeper than coaching, it would need a bit more work, a bit more, I would say, even to extend some offline connectivity from that perspective. But I would not make it equivalent to the health trackers, which anybody can buy on any e-commerce site and have it and get running in 10 minutes.
Thanks. So I think we see 2 differing views here on how this industry can work. But I think what we can all agree on is on the self-care portion of things. If you want to take a daily tracker around it, right? That's something there's data that we can use, right? And we can track around as well. One question that we do have a few regulators here as well amongst the crowd, right? How can the regulatory authorities or other stakeholders work more collaborative ensure that this space is being properly regulated from a mental health insurance perspective, and really to ensure that it can be more accessible and responsive to Singaporeans' consumer needs?
Honestly, that's very straightforward and easy. So when genetic testing came in, so Singapore has a very simple structure. The insurer cannot use a genetic test data to do a decision which is detrimental to the interest of customer. However, if it is better for the interest of customer, that data can be used. So for example, let's say a person's parents had XYZ disease, and an insurer has genetic test data to prove that this person is not going to be impacted, and that's why you don't need to put a loading on that. That's okay. But the test cannot be used for detriment of customer. Simple as that. And that's something which all insurers have to live with that in Singapore for genetic testing. Something very similar to that. If it's good for the customer, you can use it. If it's not good, then don't use it. As simple.
Mark?
Yeah, I think there's probably a few things to think through. One, again, most important thing is data and getting a better understanding of what are some of the conditions, what are the indicators, what types of treatments are effective, what does it cost to provide that treatment, what are the providers options you have in providing that treatment. So I think being able to share and pool and consolidate data for those purposes is extremely important. I think the other piece is around how do you provide flexibility in the regulations or a sandbox type structure where you're able to sort of quickly test and learn different types of products or different types of services that can be created. So I lived in Japan for about 10, 11 years, and actually they came up with quite an innovative structure for any type of insurance that you wanted to create. So helping organizations bring something to the market, test if it's going to work, make it adjustable so that we can make something sustainable. I think that's probably one of the way forward, one of the ways to progress in Singapore.
Absolutely agree. All right, we have about 5 minutes left. We'll just jump straight to the Q&A sessions. Is there any questions? Yeah. So this is a quick QR code. If you have any questions for our panelists here, you can just type it in, and I think you appear on our next slide. Again, or if anyone has anything, just Bernie can shout it out as well. I see a few people typing. Yes. We can mic.
So I'm interested in, as I'll be speaking, ASEAN countries. So this is Singapore, in which you have insurance and health insurance is quite widespread. As you go across the 10 ASEAN countries, they're very different. And what could you say about the perspectives of health insurance for those countries as well? So assuming that someone is in a company in which you have responsibility not only for Singapore, but a regional responsibility, what would your advice be?
So one advantage of some of the ASEAN countries is the cost of servicing is much, much lower. The cost of a therapist in Singapore is at least 4 times or 5 times that in the Philippines, for that matter. So you can look at it from that perspective. So there is a way to balance that part. And a lot of platforms like Intellect can actually help you have a regional solution in one shot. So I think that is a solvable problem. It's just that the key question becomes is if you are moving, so if you have local operations, then it absolutely makes sense. Some of the companies, they have remote employees. So the one challenge we have been seeing is what happens to contract employees and remote employees, because the cost structures are very different. The overall benefit schedule is different. So do you look at that? We have not seen enough organizations. They're like, let me solve my full-time employees and my direct business first. So the contract, the gig, the platform workers, we have not seen as much action yet. And that's something I think we can do a lot more on.
Yeah, I think if I look at it from a end consumer point of view, I think if we get into some of the emerging markets across Southeast Asia, I think really the priority aspect of mental health and mental wellness becomes probably lower on the order for a lot of these consumers, just in the way that the economy is evolving. So I think there's probably a duty that many organizations actually have to play to how do you start to embed different forms of mental wellness into not specifically just your product if the services aren't really available just yet or not consumable, but in your communications or in other support services that you're able to provide consumers to actually help them become more resilient or even become just more aware of what mental health and mental wellness is. Because as that country as a whole increases in its maturity, that will start to pick up as it has in other more mature markets as well.
Thanks. I think I'm just being told that we're out of time. Please give a applause for Mark and Varun. There are a few questions. They will be around in our networking sessions as well. So please feel free to reach out to them. I'll pass it on to Cassandra. Thank you.